Teqqa's iAntibiogram delivers timely, localized antibiotic data to providers so they can make optimal prescribing decisions. Before now, antibiograms were delivered to clinicians on a yearly, paper-based static format. iAntibiogram runs on any browser and on Android and iOS devices so that it can be used anytime, any place. Clinicians will open iAntibiogram to find the current data on resistance to help them select the right antibiotic for the specific patient in front of them. On the main screen, I first select an organism type. When I choose gram-negative, I see the tested drugs in the first column and a roll-up susceptibility for all gram-negative bacteria. This helps me make a better decision when all I have is a gram stain result. Key information about each drug is just a click away, such as important considerations for therapy, adverse events, and cost. And by choosing an organism at the top, I can see the susceptibilities for E. coli. These results are based on specimens from my entire organization, but by selecting a specific entity, I can narrow the results down to specimens obtained from patients at just this facility. I can narrow the results down further by selecting a location and even restrict it to the specimen source. As I do, the susceptibility of many organisms changes significantly. The blue results indicate that the susceptibility of this bug-drug combination in these specimens is significantly different from that of the health system as a whole. This helps me know when the general empiric guidelines for my institution may not apply for this particular patient. By clicking on a cell, I can see the number of specimens susceptible and the total number of specimens tested for my selection compared to the health system overall. And scrolling down the list of drugs, I can also see several common antibiotic combinations with their susceptibilities displayed. I see the susceptibility to just pip/tazo is 66%, but if I add amikacin, it jumps to 84%. This quick, interactive access to the data lets me choose therapy that's much more likely to be effective for my specific patient at this location. To see the results by drug, I can select one of the drugs in the display. Now the drug heads the column, and I can choose other drugs to compare to it. And susceptibilities for both gram-positive and gram-negative organisms display below, since both are tested for these drugs. In the same way, I can see the susceptibilities for gram-positive bacteria or other organism groups. I can also link to my organization's empiric guidelines. iAntibiogram is the key to making better prescribing decisions that yield the best patient care, while also working to battle the growing problem of antibiotic resistance. Thanks for watching. If you want to learn more and implement Teqqa's iAntibiogram at your hospital, email us at contact@teqqa.com.